So thank you so much for joining us today for our conversation around meaningful and ethical engagement of adolescent girls and young women in ending the triple threat campaign. And we are delighted to be joined by a panel of young people who are actively engaged in empowerment and mobilizing fellow community members to this cause. So I'll want to introduce them one after the other. So we will start with our first panelist. Winnie, maybe you introduce yourself, where you're from, and what you do. Karibu, Winnie. Winnie, please unmute. Thank you.
Can you hear me? Hello, good evening.
Good evening. We can hear you now.
My name is Winnie Mweni. I'm from Collaboration of Women in Development, and I coordinate adolescent and young people projects. And I also coordinate a young women movement known as the We for She movement that is geared on addressing the issue of teen pregnancy. We work in Kisauni and Nyali, and we overspill to Mwakirunge, and I'm grateful to be part of this conversation as we discuss more about the triple threat campaign. And I'm looking forward to engage with everyone and have more insights on how we can engage the adolescent and young women better. Thank you. Back to you, Nolly.
Thank you so much, Winnie. I'll welcome our other speaker, Scarlett, to introduce yourself, who you are, where you from, and what you do. Karibu, Scarlett.
Thank you. Thank you so much, Nolly. So my name's Immaculate Shisia, but preferred name is Scarlett Ima. That is like the name I'm known, well known. I'm a feminist. I'm a human rights activist. I'm a paralegal. I do digital content creation, mostly for advocacy. A champion for sexual and reproductive health and rights, and also a mental health advocate. And not forgetting being a queer person who is a human rights activist. I think that's enough. Back to you, Nolly.
Thank you so much, Scarlett, for that introduction. We are really honored to have you amongst us because in this conversation, we'd want to also get to understand how the issues around diversity and inclusion being factored in this whole campaign. So maybe I'll start with Winnie, maybe to your own understanding for a lay person. How will you define? How do you define the triple threat concept in your own terms, to the best of your understanding, Winnie?
Hope you're hearing me. Hope I'm loud enough. When it comes to the triple threat is an initiative that came through the National Syndemic and Disease Control, and the aim was to address the issue of teen pregnancy, the issue of GBV, and the issue of adolescent and young women new HIV infections. Because these things, they are kind of interlinked. You can't have HIV without GBV, and you can't have gender-based violence without teen pregnancy. So the triple threat is like an interlinked. It acts like a web. You can't have one thing without the other. Where there's GBV, there's teen pregnancy. Where there's teen pregnancy, obviously there'll be the issue of HIV new infection. Basically, that is the my layman's understanding of the triple threat.
Thank you so much, Winnie. Maybe we'll give the opportunity to Emma to also give her inputs to her understanding. Maybe to your understanding, how do you understand the triple threat?
Thank you so much for the question. First, I would just like to say, like, what is like the triple threat? You know, it is like it is the the new HIV infections, gender-based violence, and adolescent or teenage pregnancies. It is like a campaign. It is a campaign that focuses on ensuring that HIV, new HIV infections, teenage pregnancies, and gender-based violence are addressed at the local level in line with the particular needs of young people in all their diversities. That is like what I understand the triple threat concept. Back to you, Nolly. Hello.
Thank you so much, Emma, for that intro of our understanding. But also, it will be good if we'll get to hear from Nancy. Nancy, maybe we get to hear from your end how you understand the whole concept around ending triple threat. Nancy Karibu, maybe tupate your perspective on the triple threat campaign. Karibu, Nancy.
Thank you so much, Nolly. I think to my own perspective, I think siko mbali na Ima and Winnie. Naongezea tu it's all about new HIV infections, GBV, and adolescent pregnancies. Yeah. Back to you, Nolly.
Thank you so much. Thank you so much, Nancy. And one of our guests has joined us, and I would like to welcome Faisal. Faisal, can you hear me?
Yes, I can hear you loud and clear, Bananoli.
Please
Thank you so much.
introduce yourself.
My name is Faisal Okech Abdallah, and I'm the president for People with Disability Mombasa, and at the same time, a champion for the GBV cases. So, what I understand by the ending triple threat, a threat is anything that can bring negative effects in the community. And where there is a threat, we must ask risk. And where there's risk, we have vulnerability. So these three words interconnect. So what I mean that through this one, GBV is inside there. We have adolescents is there. We have teenage pregnancy is there, and also the HIV/AIDS and disease is also there. So I understand that when we cannot have a clear strategy and to stop all these things, the community will have triple effect and threat with all this dimension within the SGBV, in the HIV/AIDS, and also in teenage pregnancy. That will hinder our community to have an informed and educated people in the community. That's how I understand it. Back to you. Thank you.
Nolly, we can't hear you. I can't hear you. I don't know if I'm the only one.
I can't hear him too.
Oh, my apologies. My apologies. I was talking while my microphone was off. I'll come back to Winnie, and I just want to get to understand. So, what are some of the leading contributors to new HIV infection? Because we've seen that one of the purposes for ending triple threat is reducing new HIV infection. So, maybe from your area of work, from your community that you serve, what are some of the experiences that you've seen that are contributing to new HIV infection, more specifically among adolescent girls and young women?
Thank you, Nolly. And I like the question. When we talk about HIV new infections, there are infections that have occurred in less than 6 months. When they mean when HIV testing is done and the infection has occurred less than 6 months, that's when we call it an HIV new infection. So some of the contributing factors, one is the issue of drug and substance abuse. When you see young people using drug and substances abuse, the issue of injection, what are the nature of syringes or tools they are using to inject themselves? That is a contributing factor number one. Then there is the issue of careless sexual relationship among young people. Like sexual intercourse leads to like a greater percentage of HIV infections. And when our young people engage into careless sexual actions, that will lead to HIV new infections. In rare cases, the issue of blood transfusion and the issue of mother-to-child transfusion. That is, the mother transmits to the kids, and the child grows up with the HIV virus. Those are some of the contributing factors that lead to adolescent and young people getting infected with HIV. Back to you, Nolly.
Thank you so much for that perspective on new HIV infection. And maybe just to invite Ima with the focus on the community that you work with. What are some of the vulnerabilities, or what are some of the contributors, or what are some of the factors that lead to new HIV infections among the community that you work with? Ima.
Thank you. Thank you so much, Nolly, for that question. First, before I talk about my community, I'd just like to talk in general. I believe the main factor contributing to the new HIV and infection is lack of comprehensive sexuality education in schools and at home. Because I believe if we had the comprehensive sexuality education in schools and at home, kids will grow up understanding that their body changes, and sometimes they would want to engage in sexual activities, and they will understand that they have to use, if they find themselves in that situation, they have to use protections like condoms. And if, for example, they find themselves in a position where they have already, messed up, they can always go and seek help in getting maybe the P2 or any other contraceptive that can work for them. So in my community, in the LGBTQ community where I work, I believe the main factors is lack of access to sexual and reproductive health and rights. And there's so much stigma, there's so much discrimination when it comes to minority. And I just use the word minority because this speaks for the LGBTQ community, persons with disabilities, and people who inject drugs, and sex workers. They are oftenly mistreated and discriminated when they go to these hospitals to get services. And also the stigma around saying that HIV is it's a gay disease. It kind of holds back people who identify as gay or lesbian or bisexual to actually go and seek for these services. Another contribution is poverty. I believe that poverty is a big factor because with you can if you check the places where the HIV is very high, the new infection, especially in the teenage pregnancy, you can see it's the informal in settlements or the more marginalized communities that are affected more because of poverty. They do not have enough money to maybe buy smartphones, because nowadays we have information on digital spaces. But if that person can't afford that smartphone, and if the government is not like giving the kids comprehensive sexuality education in schools, how are they going to know? How are they going to understand how to protect themselves from this triple threat? So yeah, maybe I'll stop there to give chance to other people because I have so many of them lined up. I don't want to say all of them. Back to you, Nolly.
Okay, thank you so much for that wonderful touch on the factors which are contributing to new HIV infection. So I'd want to invite another colleague of ours who's here with us. Jerry, please unmute your microphone and you introduce yourself, and then also you can share with us what are some of the new factors that are leading to new HIV infection among young people. Jerry.
Yes, good evening. My name is Jerry, and I work for the community as a community activist. And just to give out a few things concerning what I see in my community, I think most of the times it's us youth are so used to hearing about HIV, like we are just so used to HIV, like we don't really see the bigger picture anymore. So at this point, people are just so ignorant, and they don't really put emphasis on HIV as much as before, because we have, like, if right now you tell somebody disease, or it's when you try to put the hard word on it, they'll be like, okay, but corona came and we tackled it. What's so big about HIV? People died of corona. It was a few months and people died, or a few years and people died. HIV, I can live with it. I don't see the bigger picture anymore. That's for one. And secondly, I can say I fight for the LGBTQ plus community, and uh, around my area, a lot of people have really discriminated uh, their community, and at this point, it's no longer an HIV on our side; it's HIV on their side. So, like this, trying to put it, they try to say like gay get the infections more than the normal people that get sexual. Sorry, I'm having troubles with my network. And text us.
Jerry, are you okay? Kenya loka tuk simbi ni tema ngise markiti opposite ntiega equity card Jerry, I think he's having challenges with internet connectivity. We will bring you back when we've settled that. But Nancy, I'll allow me to bring Nancy, and maybe Nancy kwa ile jamii unatoka, in the community that you're coming from, will we say that there is enough awareness for young people that can prevent new HIV infection? Are there activities?
Sorry, Nolly, can you come up again, please? Nolly, can you hear me? Hello. Hello, Nolly. Hello.
Yes, Nancy, did you get my question?
Yes, Nolly. Can you hear me now?
Yes, now I can hear you so well, Pole.
Okay. It's okay. Please come up again.
So my question is, are there enough programs that empowers young people so that we get to prevent new HIV infections in your community?
What I can say, maybe there's enough programs from partners, from organizations, and from the government. Maybe you can clarify for me, please. Hello. Yes, Nolly.
Yes, Nancy, you are.
Kwani kuna shida ya network? Can you hear me now?
Yes, I can hear you now.
Okay, I was saying maybe you clarify on which, is it by organizations, programs through organizations, or the government, so that maybe anaweza changia from there.
Just from the government level.
From the government level, I can say no, because mostly mali natoka in slum areas, unapata mostly NGOs or different organizations have really tried to engage the young people, the adolescents and the young people, to empower them about the new HIV infection. So the government, no, not yet.
Okay, thank you, Nancy, for that. I'll come back to you again. I can see internet is challenging us from all ends, but maybe Winnie, from your end, what are some of the cases? What are some of the what are some of the causes of current gender-based violence cases? What contributes to gender-based violence cases? Winnie.
When you talk of gender-based violence among adolescents and young people, it's a topic that is prone to, I would say, is a very fluid topic, Because one, the issue of our harmful cultural practices among adolescents and young women. For example, when I talk of harmful cultural practices, for example, the issue of early marriages, the issue of female genital mutilation. These are some of the issues that fuel most of the cases of gender-based violence. Another thing that would lead to gender-based violence is the issue of lack of education. When a young woman is not educated, trust you me, Nolly, the chances are that they will face an issue of gender-based violence. And this was very evident in the recently conducted Kenya Demographic Health Survey. It outlined that most of the women who are uneducated it was saying 10 out of 15 of them usually have undergone gender-based violence. So the issue of young women being uneducated is it's not even like it's per se and for sure a cause for gender-based violence. Then there's the issue of lack of awareness among adolescents and young people. Like our young people don't really know what they want, and the issue of lack of information is two-way traffic from the parent and maybe from the caregiver and our curriculum. And I won't blame the school. It's our curriculum. Our curriculum is not well packaged to give young people the right information on how to go about gender-based violence. I think the issue of the referral pathways of how you can go about a gender-based violence case should be incorporated in our curriculum so that our young people have this information on how they can go about these cases when they face them. Back to you, Nolly. I may talk too much.
Okay, thank you so much, Winnie. Maybe I'll also give this opportunity to Ima, maybe with the context of the society that you work in. Maybe are there cases of sexual gender-based violence, and if yes, what are some of the causes of those cases? Ima?
Thank you so much for the question. Wow, gender-based violence is a very sensitive topic for me. First, I'll say what affects like our community mostly when it comes to gender-based violence is the religion and cultural norms. You know, because let's say, for example, just go direct into it. When it comes to when you talk about gender-based violence, it's in so many different ways, and you find that a religious when maybe an adolescent kid has come out, this is like from lived realities of queer young people. Someone who is raised in a very religious family comes out to the family, or maybe someone outs them, because it's not easy to come out to a religious family that you are queer or gay or lesbian. Most of them go through conversion therapy, and I'm using conversion therapy because it's the word that is used, but I'm going to concentrate on corrective rape, whereby the parents or siblings or friends of this adolescent who has just come out initiate like rape this person, claiming that they are changing them or removing the demon of being gay. So this is, I think, the main cause of violence, of the gender-based violence, and also hate crimes, whereby the society, because they don't understand who you are, and the religious leaders have preached that queer people are an abomination to the society. So these people want to always harm the queer community, because this is what the religion and culture has taught them, that these people are unholy, they are sinners. And also when it comes to accessing health services. It's very difficult because if you find a healthcare provider who is religious or believes and values, their beliefs and values do not allow them to give service to homosexuals, let me just use that word, it becomes a problem, because if someone has gone to the hospital to get tested for either HIV, or maybe they want contraceptives to protect themselves from teenage pregnancies or early pregnancies, I'd say, it's hard because they get discriminated. So I'd say that is like basically what the queer community go through. And also the
Scarlett, is it me who has lost you? Hello, Scarlett.
She's not here.
Okay, then we will proceed, Winnie, to the next.
Yes.
The next. To the next. Okay, so maybe we need to your perspective. Do you think there is need for involving the counties in this ending triple threat campaign, and if so, why and how?
Thank you, Nolly. I really like the question because it's like bringing us to a point of thinking where do we go wrong, or where are we going wrong. The issue of involving if the county is really involving young people, and if what they are doing is really working, when it comes to issues of adolescents, to my own perspective and the knowledge I have with programs design or project design, the end user should be part of the design. When we just sit at boardrooms and design projects for young people and expect them to be receptive of the projects, definitely they won't partake what we have been designing for them. Going forward, I think we should go back to the drawing board, and let's go to the grassroots level and meet adolescents. Let's hear what they want in terms of how to address the issues at hand. That is the issue of GBV, the issue of the rising number of teen pregnancies, which, according to the Kenya Demographic Health Survey that was just launched the other day, the issue of teen pregnancy in Mombasa County, it's at 11%, while nationwide it's at 15%. So that's saying something that we need to put more effort on what we are doing. And the issue of new infections among adolescents, it's still high, even though we have been having intervention and more non-state actors are doing more intervention. So it's prudent for us to go back to the drawing board and engage adolescents in the project design, the project planning, and also implementation and the execution of the project. It's very key. We involve our end user, who are the adolescents, in our project design. That's all for me, Nolly. Back to you.
Thank you so much, Winnie, and apologies. my internet is a bit challenging on this other side. And I'd want to bring RISPA. RISPA, based on the context and the place that you operate in. And I'd want to know, is there a need the context and the place that you operate in? And I want to know.
Yes, sorry, I had some trouble with my network. I was also trying to. Are you guys hearing me?
Yes, we can hear. When you switch the microphone on, so I was getting feedback. That's why I stopped and I kept quiet. But you can proceed, Rispa.
Yes?
Yes, we can hear. When you switch the microphone on, so I was getting feedback. That's why I stopped and I kept quiet.
Okay, so I was trying also to get.
But you can proceed, Rispa.
Yes, I wanted to talk a bit on SGBV cases around my area. So we have issues with the local tourists we have on here, and our main problems has been when you get these cases, it gets so difficult.
I think Jerry has challenges with her internet and she dropped out. I'd want to welcome our other colleague who joined us a bit later. Ali, maybe you can get to introduce yourself and then we can get to hear your input in terms of do you feel or do you think this is the time that the triple threat campaign can be embraced or picked up even with the county governments? Ali, please introduce yourself and then you can give us your perspective in terms of engaging counties in driving the triple threat campaign. Ali.
Yes, good evening, everyone. I hope you are getting me.
Good evening.
Yes, I hope you are getting
Yes, you are
me.
clear. Proceed.
Okay, I'm Ali Hassan, Maisha Youth Secretary from Kwale County. For the issue that risen on things to do on triple threats, I think we have to engage the county government for us to move or to have a smooth way in the grassroots. For example, the cases that are happening at the community level, like the incest, where young girls are being raped by their own uncles, and this leads them to become HIV positive. I think these things have become a very big challenge in Kwale County, and for us to do that one as service providers, we can't do it alone. We have to engage the community, the county government, so that they can support and also to enforce laws and policies that will make the community also to air out their views, because in some circumstances, for example, the cases of GBV that are happening in the community, some are fearing to come forward about being raped or being abused, only because one of them being lack of knowledge, or they lack they lack knowledge on that, and also they fear that when they air out their experiences or what they are going through, the community or the family will undermine them, because all this happens from the community or individuals who are living in a disadvantaged community. So being the way they are living, like most of them, they are poverty, so they are being used for money maybe. So for all these cases, we can't carry it alone. As service providers, we have to engage the county government to provide support on that, fully support, so that it can help us on this. And also the county government also to come up with uh, programs on education and awareness on this, and also to come up with empowerment and skills building programs that empower those young girls or those victims that are affected, so that they can have those communication skills or leadership skills. And also the county can also help us on mentoring them, because when you connect for the individuals that are or the survivors with the experienced people, then I think they can have more courage on that. Thank you.
Thank you so much. Sorry for that feedback. Thank you so much, Ali, for that perspective and calling upon the participation and partnership between both the county and the national government. And I'd want to bring Nancy. Nancy, nitakuregesha kidogo, pengine pia utugusie umuhimu wa kufundisha ama wa empower adolescent girls and young men, because not all of them are in the community, those who are in school. So Nancy, how we and empower adolescents who are in school so that they can be able to prevent, because we have cases of teenage pregnancy among school-going girls, and they end up dropping out of school. And from being pregnant, there are cases whereby they're also HIV infected with their partners who've impregnated them. And also further, when they move to those families, they face the violence from those men who are older than them. So maybe Nancy, how best can we empower adolescent girls who are in school? Nancy.
Okay, thank you, Nolly. Maybe the best we can do, according to my understanding, is to give enough information about sexual and reproductive healthy rights. Also, to give them education on adequate access to services in schools, that's healthy services. And also tunaweza kuungana pia na the duty bearers, wale ambao wanafanya kwa hospitali, mainly the youth friendly centers, so that we can empower them enough. We also have the family, community, and social within, so we can also link them to the healthy facilities. Sijui kama nimeeleweka.
Yes, umeeleweka vizuri sana. Thank you so much, Nancy, for that additional input. And maybe still in the same perspective, RISPA, we know that in the community that you work with, we have cases of teen mothers who are also at risk of gender-based violence and new HIV infection. So how do we get to empower empower and equip teen or young mothers so that they are able to stay away from the possible exposure of triple threat? Rispa.
The most useful thing is awareness from the community level, from the leaders in the community levels, from the chiefs, the chairman, the mzee wa mtaa, those they really empower and give out those stories like that we talking to these people, and when we start telling them that these things are going on and this is not good, this is bad, getting a 15-year-old girl that is pregnant in this society is not should not be a normal thing.
I think we've thank you, Respa, for that input. Unfortunately, we've lost you along the way, but I'll want to invite Imba to we further the conversation. How do we get to empower the young mothers? I mean, young people who have found themselves in a parenting situation, their mothers. How do we get to empower them so that to protect, to stop the triple threats? And then also after you've topped up what Rispa was talking about, and I also want to know from your end, what do you recommend to the National Syndemic and Diseases Control Council? What do you recommend so that the Ending Triple Threat campaign can be as inclusive as possible? Emma.
Thank you so much. So maybe I'll just start by maybe what I can recommend, because I feel like we need to like have an intersectionality based approach in healthcare services, because creating better healthcare systems, you know, and holding the people in charge accountable can actually help, you know, in responding to the triple threat, sorry. And also maybe to find data, or like data for minorities who seek healthcare services, because I believe it's very low. Minorities don't seek these healthcare services because of the system and the rules, the discrimination. Like, for example, if you go to get tested, there are some situations where you have to go with your partner, and the minorities, you know, as we all know that Kenya still hasn't accepted the same-sex relationship. So it becomes hard for someone to actually go with their partner to get tested for them to feel safe, because we all know that as much as we can use condoms and all measures, sometimes these condoms burst. And when we talk about PrEP or PrEP, most of the community members do not understand how it works. So maybe sensitize the LGBTQ community more, so that they can understand how these things, how PrEP and PEP work, and also to understand their basic human rights to accessing healthcare services. You know, and there's a time I had a conversation with a few members of the community and asked them, like, what is the reason why you do not go and to seek these healthcare services? The answer was, aya, pia sisi tunakubaliwa kwenda. I'm sorry, I'm using Swahili. That is like exactly what they told me. Like, so even us, we can go to the hospitals and get services. And it might be shocking to some people, because these are people who are like maybe 30s, you know, and they're supposed to actually know, but they don't know, because maybe they are from marginalized communities and they don't have like access to education to actually learn from their peers in school or in universities, because I believe in universities this conversation is more open than in high schools and primary schools. So I think maybe a good way is to like just use the intersectionality approach so that this information and services can reach everyone, even those that cannot afford it. And also, the information can reach those people who can't even access or use digital platforms. And also, how we can empower these young mothers to end this triple threat. I think more comprehensive sexual and reproductive health and rights information, and make it easier for them to access these services so that they can use contraceptives. And I'll still say, I know it's something that most people don't like hearing about it, making sure that abortion is safe abortion services are provided, because sometimes these young mothers, or let's say adolescent, get pregnant without knowing, because they, or maybe they knew but the condom busted and they didn't know. So to provide this safe abortion can actually prevent teenage pregnancies, and can also prevent the maternal deaths that are very, very high next to the teenage pregnancies. And also just educating these young mothers about sexual abuse, not only young mothers, actually, all adolescents, so that young boys can be involved in this fight, so that they can understand that it is not good to force someone or force yourself on someone, or sexually, like, let me just call it as it is, sexually assault someone. Teach them consent, because we see that some people get some, like the previous speaker, I don't remember his name, but he's from Kwale, said that young women are being young girls are being raped by their uncles. Maybe they do not know that they're supposed to get consent. They're supposed to give out consent before they can they can engage in sexual activities. So teach them consent, because in Kwale County, in Kilifi County, like those marginalized communities, this information is not there. Like, you'd be surprised going there, finding someone who is 22 years, doesn't even know how to write their name or explain what sexual and reproductive health and rights is. So yeah, I'll stop there, and back to you, Nolly.
Thank you so much, Ima, for that wonderful perspective. And we are coming at a time when we have diverse challenges as people who are coming from diverse backgrounds. And I'd want to invite one of our colleagues who could not start with us because of the challenges of connectivity. Sometimes this technology might disappoint. So I'd want to welcome Fauzia. So Fauzia, you can have this opportunity to introduce yourself, and also you can share with us the work that you do, and possibly you can further share with us the challenges which young people, more specifically adolescent girls and young women, are facing in the area that you work with, and what you're doing, and how best can the county and the national government work to make sure that we empower the community so that ending triple threat becomes a campaign that is owned both by the national government through the National Syndemic and Diseases Control Council, the counties, and us as young people. Fauzia, karibu.
Okay. Hi, everyone. I'm Fauzia
Hello.
Wanguche. Can you hear me?
Yes, we can
Nolly,
hear
can
you.
you hear me? Okay.
Yes, we can
I'm
hear you.
Fauzia Wanguche, the chairperson of Maisha Youth Movement. And Maisha Youth Movement was derived from NSDCC, National Syndemic Diseases Control Council, to inspire and empower the youth. And in Maisha Youth, we deal with the triple threat, that's the HIV/AIDS, GBV, teenage pregnancies, and some environmental issues. Yeah, sorry, Nolly, what was the question? Okay, about the challenges I face as a service provider, mostly the SGBV field, mostly some issues are done with their the perpetrators, that the close relatives, their cousins, their uncles. So most of the cases are done under the kangaroo court. They are not ready to come and report to the stations. They are not ready to share with the service providers. Some are even given money, or some paralegals come in between the parents and the perpetrators. So the defiled or adolescent girl is like, she doesn't get her rights. Also, on the HIV and AIDS survivors, most of them, they're discriminated against. It's like unapata kama ni students, the KMTC students, some are, it's like they're neglected, they're like wako peke yao tu kwa wakiwa, yani kama kuna sessions zinaendelea, they're like wako peke yao, they take their studies peke yao, lonely. Yani once they are noticed ama wamekuwa recognized, wanakuwa like wanatengwa. Even to some schools, you get some of the boarding schools, the matrons ndo wanawaekea dawa. So some wakisahau kumeza dawa, the matrons are like wanawaendea class, wanamuita like, hii dawa ni wewe ukunywe ama ni mimi nikufate. So those are the challenges they face. Trauma pia inatokelezea when they are not well counseled. Some wanaacha hata kukunywa dawa, they are like ile stigma inaenea na vitu kama hizo. Then issue na causes of the teenage pregnancy in the county, Kwale County, the higher risk behaviors. Kuna peer pressure in schools. Then pia most of them, the forced or non-consensual sex take place. Others lack of access to comprehensive sexual education. They don't know anything about it. So wanajikuta ni first time na ndio hiyo wamepata. Some wanatoka mbali sana na the facilities, so they have limited access to healthcare services. Alafu pia kuna most wamezoea hii mambo toka kitambo, so they do unsafe sexual practices. Kuna some wana use drugs, so they use the same needle syringes to inject each others. And also
Fauzia, you've muted yourself. Fauzia, can you hear me?
okay, sorry Nolly, I got lost, network problem bado inanisumbua, sorry for that.
Okay, please proceed.
Okay, with the issue of the county government, we really appreciate because they are really supporting us. For Maisha Youth, I can say that. I don't know about the other organizations, but for the county government, at least they support, wanatushika mkono, at least most youth, like they are the public participation. I saw like 50% of us participated, and also they are collaborating with us in mostly creation of awareness and sensitization activities. They also back us up. We also have education and awareness in schools and even to these other youth, despite we don't have the youth friendly services to most of the sub-counties or the wards, but in some of the, like let me say, out of the 6 sub-counties, we only have the youth-friendly sessions in 2 sub-counties, of which at least we can see the fruits of it.
Thank you so much, Fauzia, for such a wonderful sharing of how you've worked with the counties and you're empowering people from your local community. And I know that it's work that requires an aspect of sacrifice from your end. And I'd want to invite Ima, and Ima, maybe to just get to hear from you as we are looking forward to closer. Maybe Ima, are there enough policies and legal frameworks to support the implementation of ending triple threat campaigns? Just to your knowledge, does the campaign have any backing, legal backing, or does it require legal backing? And if so, what are they and how can they be improved? Ima, to you. Oh, I think Ima did not get me. Rispa, are you there? Rispa? Rispa, are you there? Oh. Ali, can you hear me? Oh, my apologies. Then I think we are having some technical issues. We will have to close the live, and then we will organize and reintroduce it again. So we apologize for the technical hitches. We shall organize and revert back.